Hello, my friends and my colleagues and my students. Hello to everybody. Bismillah ar-Rahman ar-Rahim. I want to just give a quick reminder of the anatomy of and the clinical anatomy of the hypothalamus, because this is basic for understanding of the clinical presentation and the clinical manifestations of disorders of the hypothalamus. And I already mentioned the different syndromes related to hypothalamic dysfunctions, or what we call the hypothalamic syndromes, and their clinical presentations and implications in clinical practice. But I just want to give a quick survey of the reminder of the anatomy of the hypothalamus. The hypothalamus, as I mentioned, is a cone-shaped structure which projects down from the brain, and it lies at the center of the brain. And it is actually at the base of the brain. If we want to know where it is from, when we look at the head from anterior, that's from in front, it lies just behind and in between the eyes. It lies behind and in between the eyes. Behind and in between the eyes is the hypothalamus, exactly. And the hypothalamus is a very small organ, as I mentioned before, which constitutes about 1 to 2% of the volume of the brain. But in spite of being small in size, it carries very important functions. As I mentioned, it is an organ with or a neuroanatomical structure, or a neuroendocrine tissue or organ, which carries both endocrine and non-endocrine functions related to the homeostasis, keeping the homeostasis of the body and regulating the homeostasis of the body. That is the keeping the internal environment of the body balanced and healthful through autonomic and non-autonomic mechanisms, or autonomic and non-autonomic functions, in addition to its major role as a regulator of the endocrine system of the body, being master of the master, because it is the master of the master endocrine gland of the body, which is the pituitary gland. So sometimes we call it master of the master, because it is the master of the pituitary, together forming what we call the hypothalamo-pituitary unit, or the hypothalamo-pituitary axis. And I mentioned that it is connected, the hypothalamus is connected inferiorly and continuous inferiorly as what we call the pituitary or infundibular stalk, which connects it with the pituitary, and through which runs the hypothalamo-pituitary portal circulation and the hypothalamo-neurohypophyseal tracts. Because connected to both the anterior pituitary, the adenohypophysis, and through the portal circulation, through which pass the releasing and inhibiting factors which are formed by the hypothalamus, and they control the target cells in the anterior pituitary, the ACTH, the FSH, the LH, the growth hormone, the TSH, and the prolactin. So its continuation down or inferiorly is the pituitary, and its continuation up is the thalamus. That's why we call it the hypothalamus, because it lies below the thalamus and above the pituitary. And as regards its boundaries, the hypothalamus is bounded rostrally by the lamina terminalis. So the rostral boundary of the hypothalamus is the lamina terminalis, and lateral boundary is formed by rostrally by what we call the substantia innominalis. This is the rostral lateral boundary, and the caudal lateral boundary is the medial portion of the posterior limb of the internal capsule. So the lateral boundary, again I repeat, the lateral boundary is formed rostrally by the substantia innominalis, and caudally by the medial portion of the posterior limb of the internal capsule. And the rostral boundary is formed by the lamina terminalis, as I mentioned. And medially, it is bounded by the inferior portion of the third ventricle, or what we call the ependyma of the third ventricle. That's why the third ventricle, it actually lies between the two halves of the thalami, or the thalamus, or the right thalamus and left thalamus. Sometimes we call it the right thalamus and left thalamus, or we consider them as two halves, but actually they are two thalami, as I mentioned before. And the third ventricle, it forms the medial boundary of the hypothalamus. So the medially it is it is bordered by the inferior portion of the third ventricle, and the inferior surface of the hypothalamus is continuous with the floor of the third ventricle. That's why we say that the hypothalamus actually lies in the floor and in the lower part of the lateral wall of the third ventricle. Again, it lies in the floor and the lower part of the the lateral wall of the third ventricle. And in other words, the third ventricle forms its medial boundary. So this is the lateral and medial boundaries of the and rostral boundaries of the hypothalamus. Hypothalamus also is continuous anteriorly with the optic chiasma. That's why we say that it lies behind and in between the eyes, the hypothalamus. If we want to know where it is from, when we look at any individual from in front or from anteriorly, it is behind and in between the eyes, the hypothalamus. That's why the hypothalamus is continuous anteriorly with the optic chiasma, and that's why in some in tumors of the hypothalamus we have to examine the visual field, same as we do for pituitary disease or pituitary tumors, because the hypothalamus is related or continuous anteriorly with the optic chiasma, and it is also related laterally to the optic tracts and the medial wall or the medial portion of the temporal lobes, a continuation of the lateral relations of the hypothalamus, the medial wall of the temporal lobes and the optic tracts. And posterior, this is the anterior continuation and the anterior relation of the hypothalamus. Posteriorly, the hypothalamus is connected with the tegmentum of the midbrain, and the mammillary bodies on the ventral surface of the brain. So it is posteriorly continuous with the tegmentum of the midbrain, because, as I said before, the whole diencephalon lies at the top of the brainstem and above the midbrain. And in reality, the hypothalamus posteriorly is continuous with and related posteriorly to the tegmentum of the midbrain, because as we know, the midbrain is formed of tectum, tegmentum, and the mammillary buds. So the tegmentum of the midbrain is continuous with the hypothalamus and also with the mammillary bodies. The hypothalamus is related posteriorly to the mammillary bodies on the ventral surface of the brain. As regards, and that's why the hypothalamus, as I mentioned before, being the center for the limbic system. When I was talking about the limbic, I said before that the hypothalamus is considered to be part of the limbic system and also is a part of the diencephalon at the same time, because the limbic system contains parts belonging to the telencephalon and the diencephalon, which are both the two components of the forebrain. And I mentioned before the forebrain or the prosencephalon, and I mentioned before that the core of the forebrain is the limbic system. So the thalamus, the hypothalamus, the diencephalon, the limbic system are all anatomically and functionally related together, and with even with functional overlap. So this is as regards the borders of the hypothalamus. The last thing I want to say is the blood supply of the hypothalamus. The hypothalamus is supplied by the circle of Willis, which surrounds it inferiorly, and also supplied by the anteromedial branch from the anterior cerebral artery and a posteromedial branch from the posterior communicating artery, and thalamo-perforating branches from the posterior cerebral artery. So it has four supplies: from the circle of Willis, from the anterior cerebral artery, from the posterior communicating artery, and from the posterior cerebral artery. This is the blood supply of the hypothalamus. As we see, it has a rich vascular supply. Same as I mentioned is the status with the thalamus. I also mentioned that the thalamus is supplied by branches